Yes, sir. And as you can see, he has fungus in his big toenail. We're just going to show you before and after we cut it and smooth it down. He currently has antifungal medicine. There's a lot of different ones out there on the market. To be honest with you, if you use it regularly, it does work, but you have to be very consistent. I don't want to name products because some products are not as good as others, but you hear a lot about different things you can try on your feet for fungus, but to be honest with you, fungus never truly ever goes away. It stays there, however you can control it, and your nails can look perfectly normal as long as you periodically put the medicine on there and keep them filed down and clean. So right now, you're just showing you this fungus toenail. You know it's kind of thick, and you kind of get this scaliness sometime around the edging of the toe. And that's just your body trying to protect itself when there's excess pressure sometimes. So it's a very small callus. Okay, we'll see you again shortly. Thank you. Okay, go ahead. Oh, now we have a patient here that's 84 years young. As you can see, she has bunion, hammer toes, and thick nails that ingrow into the side. We put an anesthetic on here called lidocaine to help numb up the sides of her toes. She's sitting with a topical on this foot too, waiting for us to numb up, but you can see the toenails are thick. They do have fungus. She does have well, it's not a real hardcore soft but these toes are pretty rigid, so if she ever gets anything done, it would have to be surgery to straighten them out. So what we're gonna do here now, we're gonna cut down into the sides to relieve the pressure from the ingrowns on the toes. Sometimes when they thick like this, I can use a regular nail clipper to go around the sides and cut back into the toenail. And we go kind of far back here on the side to pull it out. See, as I'm cutting back, I'm pulling out the nail, and I get almost all the way back to the matrix, but not quite that far. And that helps give her a lot of relief from the pressure of the nail. So this is doing it. So when we come back after I finish cutting it down, you see that I will smooth down the whole top of the nail, and it's going to be nice and flat, and she'll be very comfortable in her shoes now because she has no pressure. See, she can barely feel it. She can feel it a little bit, but it's not that bad because we've already given her something to numb up the toe. Okay. 47-year-old African-American gentleman who has calluses underneath the base of the fifth metatarsal. He has a small calluses on the medial side of his foot, and his skin is just pretty dry all around. He does have fungus in the toenails, which I've already trimmed back. And what we're gonna do here, this callus is not really bad, but hopefully you can see it good on the screen. We're gonna cut it down, and we're gonna put a padding over top once we get this callus cut down. He does have pretty decent circulation, so that's the good news. So when we pad it up, we will put a little medicine on there to help it to brighten it a little bit further. We will also ask him to get a lotion. They used to pay for amlactin, and that has a little bit of acid in it, and it helps to debride the skin slowly daily and get this dead skin off. So we'll probably order him what we call CeraVe in the meantime. So for right now, we're gonna come back in a little while to show you what his foot looks like when we're done taking down the callus. Now you see we have put padding on that area where the callus was, and what we're rubbing in there now is antifungal. A lot of this dry skin also due to fungus on his feet, so we adding that in after we have already taken it down with our special tool called a Dremel. So now it's up to him to keep these feet done, keep them creamed up and to use the medicine that we are be sending over. We're sending over special urea to help finish taking down the rest of this dead skin and an antifungal. So his feet will be looking fantastic. So we'll see him again in 9 weeks. Bye now.